We'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth here at Total Healthcare. How are you, ma'am?
Pretty good.
Pretty good? And you're Dr. Denifield?
I am.
Okay, now you could have worked anywhere on God's green earth that you wanted to, right?
Well, I was black when I started, and it was different then.
Okay. Why'd you choose community health, doc?
Well, actually, I've always intended to work in the community mental health field. I started with that idea before I even went into training, and that was because I wanted to save the black people. I learned better as time went
What'd you
by.
learn? Well, where are you now? How about that? 2010. Give me a fast forward.
Well, now I've learned that all kinds of people have all kinds of emotional difficulties, and I can help them with the problems that they deal with.
Even a therapist needs a therapist, huh?
Definitely.
Okay, good deal. Any other thoughts about total health care?
Total Health Care has been here for the longest time. I worked here for a short time early in my career and left to work in other parts of the community, like in the hospital. I had a private practice, and I've worked in other community mental health centers. But I came back in order to work with the mental health program at Total Health Care and to get it going and to keep it going. I've enjoyed myself immensely and
Good deal.
been very much supported.
Good deal. Well, thank you for your time.
Thank you.
Okay. Dr. Kirk, how are you?
Good. How are you?
Good.
Okay.
Why'd you choose community health? You could have worked at any fine medical institution throughout the country, throughout the world. Why'd you choose total health care?
Well, I went into community health because I'm a National Health Service Corps scholar, and I chose to do that because I knew I wanted to work in underserved communities from the beginning, before I even went into medical school. And I started with that sort of vision when I was a Peace Corps volunteer in West Africa over 10 years ago now. So I've really enjoyed my 3 years here so far at Total Healthcare and intend to make it a career.
Good. We think you're making a great impact.
Well, thank you.
Come on up, Dr. Mason. How are you?
I'm well. How are you?
Good. Why'd you choose community health?
Well, I've always wanted to work in community medicine. I'm a Baltimorean. I was born and raised in Baltimore, and I felt very supported growing up, and I always wanted to contribute back to my community. So this is a way for me to give back to the community that's given me a lot.
What part of town are you from?
I'm from East Baltimore and West Baltimore, so I'm a half and half of.
That was a safe way out of that. Any other thoughts on total health care, what it means to our urban communities?
Well, Total Healthcare is an integral part of our community, and we have to maintain the health of our communities, and we do that one patient at a time, and I hope we do that for 40 more years as we've done it for 40 already.
Okay, good deal. How are you, young lady?
I'm doing great.
Good. What's your name?
I'm Dr. Jacqueline Fulton.
Okay, hi, Dr. Jacqueline Fulton. Total health care. You could have worked anywhere that you chose. You chose here. Why?
Well, I was born and raised in West Baltimore, and always knew I wanted to work. Once I went to medical school, knew I wanted to work with the underserved population. Never had any thought about doing anything differently. Much like Dr. Denifield, I've done private practice and worked in emergency room also. But I enjoy this. I enjoy seeing the kids grow and their families mature.
Any other thoughts on total health care?
Oh, I love Total Health Care. I've been here for more than 25 years, and hopefully we'll be here until I retire.
Good deal. Thank you for your time. Hello.
Hello,
What's your name?
I'm Dr. Adrian Dixon.
Oh, okay. We saved you for last. They told me you have all the money. Is that true?
I have all the money, right?
We need to have a meeting after this. Total health care. Why'd you choose to work here?
I am the oldest
Are you?
in terms of time served at Total Healthcare. I'm the winner.
25 plus, 26
Oh
plus?
yes, oh yes.
Okay, praise the
I
Lord.
was pregnant with my second child when I started working here, and he's 34.
Okay,
Yeah, so
good stuff.
soon I'll be retiring, but
So what's the mission of this place?
to take care of basically the people in the neighborhood. When we started out, we were mostly a neighborhood clinic. We've expanded now, but that was our mission, I think, to serve the people in this neighborhood. And that's what we've done. As I say, we've expanded our mission, but still we serve this neighborhood.
What's,
And
has there been any joy? Presumably, yes.
joy, why would I stay here that many years?
Okay,
if
well,
there
tell us
wasn't
about the
joy?
joy.
The joy is giving the people of this neighborhood excellent medical care, and I think we do. I think we all care very much about our patients. You couldn't do this kind of work because it's really grueling. You couldn't do it if you didn't love it,
Okay, okay.
and I think we all do.
Any final thoughts? On you, any final thoughts?
Why are we looking at Dr. Denifield? You think?
Well, I was about to do a pan shot. I
Denifield.
I didn't want to catch you working. All right. Any final thoughts on total health care?
Yeah, I really have spent most of my medical life at Total Health Care. As I say, I'm going to retire in the near future, and I've enjoyed it very, very much. I really enjoy working here, and I'm going to serve on the board after I retire.
Okay. Breaking news. On behalf of the community, thank you for all that you do for us. Thank you very much.
Thank you.
And keep watching BeMoreNews.com, the news before the news, where we uncover the truth.